Okay. Good morning, everyone. Good afternoon and good evening. Thanks for joining us all today. Um, I'm going to put our slides up. I'm your host today and joined by our speakers. I'd like to welcome everyone to the webinar. Uh, my name is Lisa Seolin, and I'll turn off my camera in a second once we sort of all get going. But I am Vice President of WHWB International, and I'm also an assistant professor in the teaching stream at the Dalla Lana School of Public Health in the Division of Occupational and Environmental Health at the University of Toronto. And here at WHWB, we're committed to a world where people don't become ill as a result of their work. This means building capacity to manage the occupational health risks in underserviced areas, as well as raising awareness and demanding action on critical occupational health challenges. And one such challenge is climate change. So we welcome our attendees from around the globe. And as we're all aware, as we're all experiencing throughout the globe as depicted by this map of the world is getting hotter. And not only are we seeing increases in global temperature with the last 10 years from 2014 to 2024, individually being the hottest last 10 years in recent history, but we're also seeing an increase in observed extreme heat events. And this is really a concern for all sorts of people, particularly the elderly, athletes, pregnant women, young people, and workers from around the globe. So WHWB recognizes this, as does the ILO. And it brings us to our session today, our webinar towards understanding heat for worker safety and productivity in hot environments. As a result, the ILO, has produced a wonderful report in 2024, July of 2024, where it really estimated the burden of occupational exposure to heat, as well as the burden of disease associated with that. And it estimates that 2.4 billion workers will be exposed annually to excessive heat. This represents 70% of the global workforce, and it's higher in places like Africa, Asia, and the Arab states. It also represents about 23 million non-fatal work-related injuries and up to about 19,000 annual deaths. We recognize this is a serious problem at WHWB, and as a result, we've convened a working group with really objectives. And if you're interested in joining the working group, we invite you to do so, to really share around the world solutions for managing occupational heat exposure and advancing a rights-based strategy in the recognition and prevention of heat-related illness. And this brings us to today's session, and I'm going to introduce our speakers today. We have the wonderful opportunity of hearing from Dr. Thomas Gassert and Dr. Ronda McCarthy. Dr. Gassert is a specialist in environmental and occupational medicine and internal medicine. And prior to medicine, he was an occupational hygienist, a high school teacher, and a factory worker. He's long been associated with Harvard's School of Public Health, Chan School of Public Health. And since the 1980s, he's had experience in international work, mostly in Asia and the Pacific, including technical services work in occupational health with the World Health Organization since 2017. His most recent work with the WHO was in 2024, where he worked with the WHO and the Lao People Democratic Republic Country Office, where he collaborated in the drafting of a national occupational exposure standard for outdoor work and a guidance for its implementation. His international focus in recent years has been to address what he sees as 5 critical challenges for planetary health, and those include climate change impact on communities and workers, the global burden of worker disease and death, pandemics, migration related to armed conflicts and climate, and ensuring the ethical use of artificial intelligence. Also, we have Dr. Ronda McCarthy joining us, and she is Concentra's Senior National Medical Director for Medical Surveillance Services. She has completed her residency at the University of Pennsylvania and is a board certified in occupational and environmental medicine. As Rhonda's based in Texas, she's no stranger to heat, and she has a lot of experience in both research and practice with worker populations and employers in recognizing and responding and preventing heat-related illness. In 2019, Dr. McCarthy was invited to provide expert testimony on heat illness prevention research to the U.S. House of Representatives Subcommittee on Workforce Protection. So today, both Tom and Rhonda will speak for 25 minutes, and then we'll have an open forum for questions and discussions. I invite you to place questions in the chat, and I will read them out. And we will hold these discussion after both presentations. And with that, I'll hand it over to Tom, who will share his slide.
All right. Well, friends and colleagues, thanks first to our host, WHWB. Dr. Ronda McCarthy and I warmly welcome all of you from many nations. We start today with an overview, a scope, and a framework. The broad thinking needed to be effective, mitigating heat exposure and adapting to it. We will only touch on key matters that will be covered in more detail later in this webinar series. Also today, we will invite your questions and real-life experiences with heat at work. In the discussion, we will ask for your suggestions on how to make this webinar series useful to your practice in protecting workers. In this first talk, I will touch on the main points of each slide and invite you to relax and listen. The slides will be made available to you for review, so there's no need to write notes from the visuals. However, you can take notes on what you hear, if you like, and then during the discussion period. There are 4 slides of key resources at the end of this first deck presentation that will not be shown, but which may help you explore the topic in more depth later. So I'm going to turn my camera off so I'm not distracting you. And let's start here. So there are no conflicts of interest for me. I have been doing contract work with WHO, most recently with the Lao, People's Democratic Republic, on heat exposure prevention, but also over many years teaching basic occupational health services in many low and middle income countries, mostly in Asia and the Pacific. And this is my contact Gmail. So, key messages. Let's focus now on the health impact of heat on workers and economies. Elevated heat can become an invisible poison and a killer at higher levels. The cure depends on human behavior. And I think of heat as a fluid. So we are sailors who have to navigate it. It's not a strict science, but there's a lot of science involved. Perhaps the best tool is to use the precautionary principle to avoid paralysis by analysis and to act quickly. We have an 8 billion population globally, and about half are workers. And we have 2 billion children, all of whom will be entering the workforce in the next 15, 20, 30 years. We are seeing that heat is impacting 2.4 billion workers now, with an estimated $2.4 trillion in productivity loss by 2030. And 75% of workers in Asia and the Pacific face excessive heat. And this extends, of course, into the southern tier of Africa and Latin America. So today we offer a vision and a framework for protecting workers. And we start with, I always like to start with ethics as a key framework. It's not regulatory alone, but it's ethical practice. So the Global Code of Ethics for Planetary and Human Survival are what we focus on. And in healthcare, generally we have 4 ethical principles for personal and worker health. And these are known simply as autonomy. The person decides for themselves what their health care should be, but they need to have access. but there's also beneficence, non-malfeasance, that means doing no harm, and justice with equitable distribution of benefits and fairness. But with planetary health, the planet itself gives us life. So we need to protect that as well for future generations. So intergenerational justice and more than human rights, including ecosystem rights and distributive justice, leaving no one behind, use of the precautionary principle to drive down risk, and the right to know and act. um, especially for the vulnerable. Less than 1 in 5 workers have access to occupational health services, and the vulnerable workers include women, children, the aging, who often work until death, migrant workers, as well as disabled. This chart shows the problem that we now all face. And you can see here the onset of the industrial period from the mid 1800s are what we've been reporting on until you can see up here as we reach the year 2024, the average temperature rise over pre-industrial temperatures is 1.55 degrees Celsius. This is um, the goal of the 2015 Paris Accord, which was hoping that the world could achieve 1.5 Celsius as a limit before 2050, but we've already surpassed that limit in 2024. So, the key things to know for scope and framework and to develop a heat action plan roadmap. So know your country, write a profile against which an action plan's success can be measured. Frameworks exist. Try, for example, the World Health Organization's 3P framework to address worker heat threats. The 3Ps are to promote health, provide health services, and to protect from emergencies, such as climate. Use best practices to get value for your money. Start with outdoor workers and have all stakeholders at the table, as well as experts and money. So workers, employers, uh, support organizations, the trade unions, and so on. The legal and health frameworks also provide guidance, and these are based on country knowledge largely. So for regulatory compliance, you need to understand the labor law provisions on worker health. And if you have a National Occupational Safety and Health Act or program, usually there's a general duty to protect workers' safety, health, and well-being. And this forms a legal basis for you to act on heat exposure. We also now have an obligation to adhere to ILO Conventions 155 and 187. These are the Occupational Safety and Health Conventions and the framework that guides employers' role, 187, in providing occupational health services, occupational safety and health. And these are mandated since the year 2022 as the fifth pillar of the ILO's fundamental principles and rights at work. So whether or not the country has adopted these and ratified, it doesn't matter. Every member of the ILO, member state, is now obligated to follow these two OSHA standards. And there's a third key standard on occupational health services called ILO Convention 161, and the recommendations or guidelines for rolling it out, implementing is number 171. You can look these up on the internet. I will give you the links in the next slide. So on the national side, we can see that uh, you want to know uh, how climate change impacts work and resilience to heat. And these various partners can help. So there is country epidemiology, the history of heat-related illnesses and injuries, HRI we call it, and also developing a country profile related to climate. And there's a guideline for this, which I will mention. There's also the World Bank Group and its various regional banks, such as Asian Development Bank, Africa, Latin America, and so on, the climate risk country profile. You should be able to look this up on the internet. There are WHO partners which uh, take care, and this is typically your Ministry of Health in your nation. It provides the health aspect of the National Adaptation Plan for Climate Change, and you can look that up. The WHO recommendations for climate resilience and the stakeholder consortia. So here you can see highlighted in yellow are the 2022 ILO fundamental principles and rights at work, making it mandatory. All must follow these OSH conventions. In addition, there are recommendations for these, how to implement them. And then we all should probably follow Convention 161 and its recommendation on occupational health services, even though it's not mandatory. And the Sustainable Development Goals of 2030. These UN goals include, there are 17 of them, but the key ones for occupational health include universal health coverage that includes occupational, as well as clean water, very important in hot climates for no chemical or biological risks, and decent work, as well as climate action. The Health National Adaptation Plan is the health aspect of a nation's climate national adaptation plan. And key components for your country that you want to emphasize is how to establish an occupational health exposure standard and guidelines to implement it. You also want to monitor their implementation, set up surveillance so that you're monitoring and developing the epidemiology and the effectiveness of your services, as well as developing the capacity, human capacity, training doctors, nurses, hygienists, safety people, inspectors, and having the budget. So you can see here some of the key organizations that are focused on worker health and climate impact, especially heat stress, including the Green Climate Fund, the Global Environmental Facility Funding, and the World Bank groups. Also, we need the weather services, very important for environmental risk assessment. And these include developing a country assessment report for strengthening the hydrometeorological services of whatever your region is, for example, Southeast Asia. And developing a key real-time data, timely, accurate forecasting and warning about heat waves, high heat stress, um, and just periods of hot days, so you can have projections and forecasts. These are very important for planning work activities. The industry challenges are particularly strong for outdoor work, particularly for large informal and migrant workforces. And about 80% of these people are in agriculture, including animal work, forestry, and then also construction and mining as well, road work, roofing, etc., transport. So health services are challenges and are highly burdened in the primary care setting, let alone the dearth of occupational health. So capacity building is paramount, and artificial intelligence is now helping with weather forecasting beyond 1 week, up to 2 weeks. There's pretty good data reliance. Here, so what do we need to know? Uh, um, without good knowledge, we can expect costly mistakes, and the global cost of work-related disease and deaths already costs 6% of gross national product globally. And we have to consider indoor versus outdoor plans and informal versus formal, and how to empower workers and the most vulnerable. And by the way, down here, the starting point is you want to get a baseline of your national regulatory, weather, and occupational health service to figure out what the gaps are. And in this way, you can develop an action plan roadmap and then reassess after 3 years or 5 years to see what your accomplishments have been. I show this slides on almost everything I talk about, and it's basically the teamwork approach, best practice for providing universal occupational health services as a dynamic cycle. And there are levels of prevention. So primary is really industrial hygiene, occupational hygiene, safety, inspection to control uh, uh, and uh, do the exposure risks and manage disasters and prevention. The goal here is, of course, decent work, decent life, health services, and climate control. However, we need also the medical and nursing aspects of surveillance, biological monitoring, training, and communication. Okay, these are to explain the medical aspects of heat exposure. And then the tertiary level is having a link to the health services, emergency health care, local emergency room, as well as primary care and your local occupational health service care for managing injuries, illnesses, disability, and return to work. So on the basic primary level, we always talk about the control of hazards, and most of you are very familiar with all these standard practices. So we start with the most important ones, the most effective, being elimination, substitution, and the engineering controls. And then less effective but important are the administrative policies and those kinds of things, use of this substance status sheets and the globally harmonized system of hazard communication. Then last line of defense is personal protection. We can combine these in control banding strategies, and you can see here the diagrams, okay? So there's a hazard control effectiveness as well as a business value, and this shows you the stratification again. There is a video here on hierarchy of controls. And for health services, remember I talked to you about promotion, providing health services. That's the WHO P2. The three Ps of WHO is the second one is to provide occupational health services. And so we talked about primary controls at work before somebody gets sick. Secondary is the health monitoring. And this is very important for heat to understand how to monitor workers, that buddy system, the first aid responders, that kind of thing. And then prompt medical referral for injuries and illnesses, as well as tracking the diagnoses so we can build an epidemiologic database that you can, from which you can learn the hotspots where you can provide extra resources. Okay, so first aid responders at work and local healthcare services, records, and reporting. Here you can see a general scheme. On the left is the centigrade, right, Fahrenheit. You can see a normal temperature for the humans is here. This is pretty standard for humans all over the world. Some may be a little bit more acclimatized to heat simply because of daily exposure, whereas others may not be, and they'd be more vulnerable. However, when the core body temperature gets in the range of 38 to 39 degrees, you're already moving into what we call hyperthermia, or a high core body temperature, which puts a lot of strain on the body and requires frequent rests. Okay. So that's your temperature scale. And you can see here with heat stress injury, uh, we often distinguish between what's directly related to heat exposure and then what else happens when you're hot and exposed in hot environments. There are all kinds of other safety and health dangers. So here you can see um, that uh, from least to most dangerous is heat stroke, up to 80% mortality there. And the heat exhaustion is a compilation of some of these other things. However, syncope is an odd one that in that people don't realize that if somebody faints from heat, like if you're standing in the heat and you collapse, um, that may be just vasovagal, but in fact, it could be a heart attack, or it could be a stroke, or it could be complete dehydration. So you want to lie the patient down, put their legs up, and are they responding right away? If not, and if they're not oriented, you must activate emergency medical services. Is there a pulse? If not, start basic life support, chest compressions. And you need to think about the differential for syncope or fainting, which could be any of these. Could be a seizure, diabetic coma, narcotic overdose, or pregnancy problem. Okay. And the other heat risks, so mental status changes, so poor judgment, risk taking, forgetting, aggressive behavior, maybe even violence, and endangering others. And then more physiological ones, a change in vision, you're getting blurred vision, you start to fall, you get tool injuries. If you go on a hot surface and fall down, you get severe burns, uh, gradual onset or even acute kidney disease, and other mental status and mental health problems. Burns is often overlooked as a problem, but during high heat and heat waves, sun-exposed surfaces such as asphalt, brick, sand can reach temperatures as high as 82 degrees Celsius. And at this temperature, third-degree skin burn is immediate. This is a temperature chart here where you can see on the left side Celsius temperature of surfaces, and you can see the third-degree burn time is extremely rapid. Second degree burns develop typically blisters and may not be apparent for 12 to 24 hours. So anybody with a burn, you must monitor them. They must get them medical attention. So what happens when the doctor sees you? Well, they do a work note. So this becomes a medical record. So what is the complaint? What happened? What's the gender, age? What's their job title? Were there any substance data sheets? What was the heat temperature? And so on. So what are the subjective complaints, the symptoms? The objective is what you see on exam and what the test results show. Are there any medical records to review? And then you make a diagnosis rooted in the cause based on the evidence. And then you make a plan and a report and a disposition as to whether to return to work with or without restrictions or keep them out of work for referral. So you want to report these things, and we use diagnostic codes. These are WHO codes to be used in every country by all medical providers. And in this way, we can create the epidemiology to see what is the burden of disease. Okay. The WHO also issues a cause of death form, and this is very important to know how to fill this out. The doctors need to know this. So we use the ICD-11 codes. There are 4 levels of causes of death. So for example, if the proximal cause of death is a heart attack, but it's due to heat exhaustion, then both causes should be listed. Heat might be listed, or heat stress, heat exhaustion, as a secondary cause leading to the proximal heart attack. Okay, and you can find this at this link. So also we look at standards from other nations, and they vary quite a bit. There's no international model yet. Here is the 2024 proposed US OSHA National Occupational Heat Standard criteria. In the US, it has been a many years process to develop a heat standard. Goal is all named industries and employers develop a written heat illness and injury protection program, HIIPP. And if you scan down the list on the left, you will see key components for a national heat standard, which OSHA is currently basing on heat index thresholds for initial heat and high heat. However, OSHA prefers that the WBGT index be used to include radiant or sunlight heat and air movement. So the heat index here, you can see, is is air temperature adjusted to relative humidity in the shade with no wind. It approximates the wet bulb globe temperature, WBGT, but only in the shade and with almost no air movement. In the sunlight, you must add up to 7.5 degrees Celsius to the heat index to estimate the WBGT. So sunlight is absolutely critical as a source of radiant heat. And you can see these classifications here are in codes of green, yellow, orange, red, and extreme. So this also is used in my review of most countries. Almost everyone ends up referring to the ACGIH global screening recommendations for heat stress exposure. As you can see here, it gives you a work rest cycle. It's sort of like a TLV, and it's separated out for acclimatized workers as opposed to unacclimatized workers. Okay, so that's an action limit for unacclimatized. And you can see the values are different and they are based on workloads. So what are the examples of workloads at rest, such as at sitting quietly, or light work, moderate work, heavy work, and very heavy? And you can see these are some examples of what these are. In a later session, we'll learn how to calculate these. Here are some tools and charts, calculators, apps, and videos. This is a great one, the Humidex reading from Ontario, Canada. Here is the heat stress tool kit, which estimates the WBGT from also from Ontario. And there's some videos here, as well as a pocket card and use of a thermometer and hygrometer for humidity readings. If you don't have a heat index report and you don't know how to measure the WBGT, this can help you. Also, actually, what's really fabulous is this new app, which is based internationally and internationally tested and reports for international locations around the world. Is the American Industrial Hygiene Association Heat Stress mobile app, and version 2 is now out. Version 1 was in July 2024, and the version 2 now includes indoor air as well as outdoor, and it gives you real-time WBGT index and a 5-day forecast. The links are here. Other aspects that people do to try to avoid high heat periods during the day is night work, adjusting sleep. There are issues on housing, water, and disasters. So night work to avoid high heat daylight can lead also to accidents and errors due to poor sleep or poor visibility. The employer-controlled housing and transportation becomes a work-related exposure risk issue if the employer owns where the worker lives. This is particularly important for migrant workers. We have to ensure safe waters free of chemicals and pathogens and prepare for disasters related to storms, floods, droughts, etc. What about temperature numbers? They can be very confusing. Um, but we all need to understand what are the global projected heat surge in our lifetimes and how to drive down greenhouse gas emissions. We also need to know about the ambient air around us at work in the close proximity, metabolic and physiologic changes, threshold action and limit values, and acclimatization. And also, we need to understand the physiology of core body temperature, how to keep it there and how to measure it, and the early signs of heat-related illness and injury. Okay, we will learn this in a subsequent webinar. Okay, but for the global trajectories now, some countries have recently issued plans for preparing for 3 to 4 degrees Celsius average temperature rise by the year 2100. Okay, so uh,
Tom, I'm just going to remind you that we only have about a minute or two left.
okay, we're just about finished.
Okay, great.
Yeah. So, what are the key aspects of health informatics? This is sort of the fun stuff that we're looking at how to better control heat for workplaces using use of technology, sensors, and so on. So, encourage you to attend consultative workshops periodically, get a better handle on weather reporting and forecasting, and we're getting more granular, localized WBGT real-time forecasts, especially with AI predictions, mobile apps and wearables. Very important. They're becoming cheap and they're very useful for migrants, gig workers, informal sector. A wide range of training and education tools, climate curricula. We're going to have a session on climate in this webinar series, and wearing of biometrics and electronic health records that are directly linked to National Public Health Service and Departments of Labor for worker compensation case injuries. So, what are some key questions? Well, um, some important questions with regard to heat exposure are, I've listed a bunch here, but I'm just going to mention, what are the heat measurements that will be used and adopted in a regulatory way to guide worker protection from heat stress in your country? Okay, there are international standards, but looking at other nations, there are not yet strong consistency. This raises a question of whether the standards for taking action, such as a threshold limit or action level, should be based on human physiology or based on economic needs. There's a conflict there. We need to find a solution, a resolution, so that workers can remain productive and at work and earning money to support themselves. The research so far shows that human physiology is basically the same globally, with the exception of persons who are more vulnerable and therefore at greater risk. And second, can each nation decide heat protection standards and how they are applied based upon local situations, types of work, culture and language, and methods known already to work? Yes, I think so. Also, in standard setting and in guidelines for implementation, stick to the medical science of human physiology, but also use locally appropriate ways to protect workers. Should public health heat measurement guidelines, for example, a heat alert or heat wave warning for the public, be the same as worker standards for hot work, workers who must work with a heavy workload? So we have to think about the difference between public health standards and worker health standards for heat. What questions do you have? So, most important, lead with compassion and swift action. There's no time to lose. Educate everybody, from children to workers to seniors. Create flexible worker empowerment to work in heat. Develop real-time portable WBGT and personal measures. Fund heat standards and guidance to implement. think about vision zero. Zero heat-related illnesses and injuries, and keep them productive, leaving no one behind, and zero greenhouse gas emissions from workplaces. This is a manager goal to protect planetary health as well as your local community. Like I said, 4 slides on resources follow. And remember, heat is a fluid. Learn how best to navigate the heat waves. Okay? And so, as for the future, it is not a question of foreseeing it, but of making it possible. Thank you very much. And I hand this over to my colleague, Rhonda McCarthy.
Thank you, Tom. Rhonda, I'm going to ask you to share your slides. I do notice that there were a couple of questions in the chat. I've written them down and I've recorded them and we will discuss those after Rhonda's presentation. And I've also provided a link to today's slides for everyone with all the resources that Tom shared as well, listed there. And that's in the chat as well. Thanks. Okay, Rhonda.
Are you
Thanks,
okay?
Rhonda.
Are you seeing my screen okay?
We are seeing your screen. Looks great.
All right. All right. Well, thank you. And thank you, Tom, for providing excellent comprehensive framework on occupational heat stress. So I'm going to switch gears and use my experience working directly with employers and their employees in hopes to further move towards understanding how we can provide safe and productive work in hot conditions. Oh, and then also I have nothing, I am just going to disclose that I do work for Concentra. We are based in the United States. We do provide heat stress medical surveillance, heat-related illness and injury care, and return to work evaluations. Our employers are national and they are also international. And there we go. Okay. As Tom and Lisa discussed, we are here today because approximately 70% of the working population globally are exposed to excessive heat. Extreme heat poses serious threat to workers whose livelihoods depend on exposure to increasingly hazardous temperatures. The International Labor Organization estimated that excessive heat contributes to nearly 23 million occupational injuries and illnesses annually, resulting in nearly 19,000 work-related deaths, which are estimated $361 billion could be saved if heat illness prevention measures were put in place, although the lives lost are priceless. I think this is just a wonderful representation of what's going on currently that was also provided by the International Labor Organization, and a quote from the UN Secretary General Antonio Guterres: "If there's one thing that unites our divided world, it's that we're all increasingly feeling the heat. Earth is becoming hotter and more dangerous for everyone, everywhere. We must rise to the challenge of rising temperatures and step up to protections for workers grounded in human rights." To prevent heat illnesses, accidents, to reduce costs and increase productivity, we must understand the factors that add to our employees' heat loads. And these include the environment that we all are very aware of. The environment also is additive with clothing and the equipment that's required for the work. Metabolic, the physical activity. You have a baseline metabolic, and that is increased with the physical activity, the physical load. And there are individual factors. And the body cools itself with sweating, vasodilation, decreasing the activity, which is rest, so that decreases the internal heat production, and seeking cooler environments, behavioral adaptations, shade or air flow. So we have to think about how the body cools itself to understand why we need to put some of these protective measures in place. This slide right here is was provided in a novel concept for human heat tolerance by Tom Bernard et al. It was published in 2024, and I think it's just a wonderful slide on heat stress and its impact and how it's complex and multifactorial. And this is why every employer needs to work on their and look at their heat risk and what they need to do about the preventive measures specific to their work site, because there are so many factors. I'm just going to use my pointer to point some of these things out. So we have the figure here that goes from heat stress to the person to heat strain. And what contributes to heat stress, as we looked at more simply in the figure before, is that you have the environment or the exposure. So you have the environment, the metabolic rate, the clothing, and then you have the characteristics that can be additive. Is what is the work, the job description, what is the time exposed to the heat, the is it constant, is it intermittent, what is the duration, is it an 8-hour shift, 12-hour shift, is it occur in the morning, in the evening? So what is the environmental exposure and its characteristics? And then you have quite a few personal characteristics, some that can be moderated, such as situational factors, as the person's acclimatization state, their hydration state, whether they're healthy or had just recently had an acute illness, and then also incentives that are placed at work, whether there's a production incentive, overtime, etc. There are physical characteristics that are not able to change, but then there are modifiable factors that play into it, such as a person's overall health. And then there's inherent factors that are not modifiable. And these all play into the heat strain. So you have the heat stress, and then the heat strain is when the body is trying to compensate. And when it's having difficulty compensating, it impacts the body temperature, heart rate, sweat rate, and the person's perception of their heat environment. What we want to try to stay in is the compensable. I want to stay here in the compensable and not go into this critical area where we have outcomes with heat-related illness, decreased performance, and injury and accident. So I think this is just a nice graph to show how complex it is in the factors that must be taken into consideration. So recommending measures for worker health, safety, and productivity. I'm going to look at this framework here that will include stakeholder agreement, assessing risk, which is measuring the heat stress, since we're looking at heat hazard, evaluating what available workplace controls are, what are the available workplace controls for the employer, and constructing a heat safety plan around that. And we will talk on each of these topics throughout the presentation. So this is what we will work on to provide workers a health, safe and productive place to work. So looking first at stakeholder agreement. Stakeholders include executive management, health and safety professionals, human resource managers, the exposed employees, and their supervisors. Stakeholder agreement to establish worker safety and their health and productivity guidelines is essential to creating a heat illness prevention plan, a heat safety prevention plan. You must have buy-in. So when I spoke about this previously, I did not emphasize the stakeholder agreement because we just focus more on the logistics of the plan. But the plan won't be disseminated if you don't and utilized if you don't have all stakeholders involved. And this includes the employees at risk. I mean, everyone needs to have a seat at the table to advise on the risk and what interventions could be utilized, because the employers and the supervisors are the ones out in the field and may think of things that the management who may not be as close to the work can think of, and then management are providing the funding and the ability to provide the resources for the plan. Next would be assessing the risk. These are well known. Tom touched on these, Tom touched on these earlier, and these will include how to prevent and mitigate the impact of this workplace hazard. And as we discussed, heat stress encompasses the environmental and the metabolic heat that's produced by activity, and then the characteristics of those. Specific to the work site will be the external environment, whether it's indoor, outdoor, the geographic location, the job physical requirements, again, as we discussed, the number of hours of exposed heat per week, and the level of exertion. Clothing and PPE requirements also add. You're going to have more heat exposure, compounded, more heat load if you have occlusive, dark, heavy clothing. Anytime we talk about risk assessment and preventive measures, no matter what the hazard, we talk about the hierarchy of controls. This was touched on as well, with the most effective being elimination of the hazard and the least effective PPE. And sometimes I always like to bring this up because sometimes we think of PPE as being the one of the most best interventions. People are always asking, can I use a cooling vest? What can I wear to help keep me cooler? Now, while those are very important, if we can eliminate the hazard, then we don't have to implement these controls. Unfortunately, the heat and the higher ambient temperatures seem to be here and here to stay, and they're getting hotter. So if it's indoors, if it's indoors and as outdoors, we want to look at more to engineering controls on how to cool the environment. And then for heat illness prevention, really administrative controls play a big factor as well. So we will look at these more closely. Also, to address a heat illness prevention plan, we want to regularly monitor the heat. So we'll look at whether you have a heat risk, but then on a regular basis, when employees go out every morning or prior to the workday, you want to measure what that heat is. Tom did touch on different applications that can be utilized, but some employers would use just the monitor, such as a wet bulb globe temperature monitor, which does evaluate the ambient temperature that includes the humidity and the wind speed and radiant heat. So it is the most accurate. Ways you can utilize this if you do not have a mobile or stationary device, such as pictured here. There are applications that can be utilized to find out what the temperature, the wet bulb globe temperature is in your area. And I put a link here on the deck. And also the heat shield is available in Europe, and it actually forecasts out 2 weeks and provides what the risks are for areas in Europe. So that's a wonderful resource to have. And there's a link to that as well. Alternatives to wet bulb globe temperature include dry bulb temperature and heat index. The heat index is a screening tool that uses temperature and relative humidity to calculate the adjusted temperatures, representing how conditions feel. So it more accurately describes ambient temperatures alone. But again, wet bulb glow temperatures are the most accurate to measure heat stress and an employee's risk. But in actuality, the heat index is probably easier to use and is often used by many employers in the work site. So here is a QR code, and again, the slide deck will be shared. QR code for the heat index, I'm sorry, the OSHA heat app, which is available in the United States. And I think I also, yes, and I also provided the app, the link to the AIHA heat stress mobile app, which is internationally based. So that is very, very valuable. And as Tom said, it was recently available. So this is these are application based and easily accessible, and employees themselves can download them on their phone if they have a smartphone. Oh, and just going back to the applications, on the OSHA heat app, it also has safety measures, first aid and emergency response, and it is available in English and Spanish. Looking at engineering controls, we need to look at whether you're the working outdoor, indoor, or combination. For outdoor engineering controls, shade is vitally important. Portable tents, or tents if you're working in one place, portable tent if the work is moving, and it needs to have enough capacity to hold, to allow the workers that will be rest, whether they're rotating or all at once. So to have a capacity for them to sit and rest and provide enough shade. Misters are another engineering control to help cool the employees. Indoor air conditioning cools the environment. Ventilation for airflow, reflective shields to redirect radiant heat, insulating hot surfaces, reducing humidity indoors by sealing steam leaks and keeping floors dry, using fans for personal cooling to increase the air circulation. This could be done for indoor or outdoor, but remember that when the temperatures are above 35 degrees Celsius, it actually adds heat to persons and should not be used. We're moving on to administrative controls. And administrative controls can be simple and very affordable. Here, I went ahead and did not include the temperatures on the gradation because the safety thresholds should be based on work intensity and using the wet bulb glow temperature. So it's going to vary depending on the work, the region, and primarily just the physical demands of the employees. So with the lower risk level, you want to set up that available, accessible drinking water. And the expectations for drinking regularly, to drink before you get thirsty, to have potable drinking water that is near the employees, that is accessible. If it's cool, that's better. To have fluids with electrolytes is also, if persons are doing physically demanding work more than 2 hours at a time, is important to prevent hyponatremia. Having sanitation toilets in and close to the work area is extremely important. You always hear rest, water, shade, but it really needs to be rest, water, shade, and available restrooms, whether they're portable or not. But persons will not drink if they don't have an available sanitation areas. So that needs to be provided, and it needs to be acceptable. Also, during the lower risk time, you want to plan worker safety training on first aid, emergency response procedures, and what is heat illness and what are the signs and symptoms so they can recognize it and bring that to their supervisor's attention. Sunscreen, prevent burns, and start implementing the acclimatization plan. So each of these will add on each other. So going to the moderate risk level, consider scheduled breaks, moving work hours earlier, worker rotation, set up a buddy system. And then as we get to the higher risk levels, you may even want to just encourage drinking. I know I worked with one company where they kind of used the military system where they had like little beads to help remind them to drink a liter of water every hour. And then physical exertion limits, using mechanisms to decrease the physical activity load, such as golf carts to transport people or mechanical lifts. And then have someone trained to monitor people, because once, and as Tom mentioned on the heat illness, once you go from heat exertion to heat stroke, that change is neurologic. And that's why we ask for the buddy system, because when you start having neurologic symptoms, you don't know to take yourself out of that situation. And so you need either a trained personnel, your buddy system. They talk about also two-way communication, and that's when you need to, that's why the training needs to occur to allow those symptom reports early versus waiting till it's too late. Because once somebody is at heat stroke level, they may not even, they may not know to even call for help. So having that trained personnel during high risk levels is important to identify those persons that need to be taken out of that situation and addressed medically. And then high risk, just reschedule non-essential activity until the heat reduces. Move essential tasks to night, and if you can, just stop work if the control methods are not adequate. Acclimatization is is one of the most important aspects of the administrative controls. It helps elicit physiologic adaptations in individuals that enhance their thermoregulation, their fluid balance, their ability for their cardiovascular to adapt to the heat stress, all which contribute to their enhanced performance in the heat. Ideally, you want a 10 to 14 day acclimatization plan, but here are some proposed acclimatization for the work site that would be a minimum. And these are for healthy individuals. So for newly hired workers that are not that have not worked in a hot environment, this is kind of more detailed here in 96 minutes, 192 minutes, but you can look at it as basically an hour and a half the first day, a little over 3 hours the second day, almost 5 hours the third day, to 6, and then to the full 8-hour day, and they're going on an 8-hour day. And this is also with breaks. Or with breaks scheduled as you increase the hours, and then depending on the heat level. And then those who are acclimated, who have previously worked in a hot environment, say they have been absent due to a prolonged vacation for 7 days, or an illness or heat illness, you can go to 4, 5, 6, 8 hours if they're healthy and can return to work without restrictions. The other element that we previously touched on that is very important, that is common to many successful heat illness prevention programs, is training the supervisor and employee. You want to train prior to the heat illness. Train them on heat illness prevention symptoms, first aid and emergency response procedures, and then how to use a buddy system. And then provide opportunity to ask questions. I have resources later in the deck that gives you some examples of some training that you can use, just scenarios that you can use for your employees and adapt them to your work site. So you want to go through like a procedure for how to respond to that heat illness, when and how to contact emergency services for your area, and how to give clear directions to the workplace should an emergency occur. Medical monitoring. This is what can vary depending on the work site, again, specific to the work site and the employer. It can decrease heat-related illnesses and decrease associated costs if you're able to add medical monitoring into that program, because these are some of the risk factors that are individual factors that an employee may have that can increase their risk for a heat illness over the baseline risk. So having an elevated body mass, a prior heat illness, poor physical fitness, alcohol or drug use, an acute illness causing dehydration, certain skin conditions such as having burns, which we know can happen working in hot conditions, and then existing chronic illnesses, which can be exacerbated by the heat and also exacerbate or increase your risk for heat illness. Physiologic monitoring. Again, physiologic monitoring may be implemented by the employer through trained first aid personnel or the employees themselves. So this is another tool that can be utilized to help improve health, safety, and productivity. Vital signs are usually the most common physiologic monitoring that's applied, and it can be applied by the worker if someone is noted to be having signs or symptoms of heat illness by their buddy, or as part of high heat procedures such as in firefighting. Develop physiologic monitoring protocols that are appropriate for the workforce and the workers being assessed. And I do have resources available that show self-monitoring instructions, like how to take your pulse or body weight before and after work at the end of this presentation. Another easy way to self-monitor is that's important to have those added sanitation facilities is urine color. Knowing if you're hydrated to dehydrated, and just looking at the color of your urine and knowing when to increase your fluid intake and electrolyte intake, or if you need to alert someone and let someone know especially if you're having signs and symptoms of heat illness and you're not urinating very frequently and it's very dark color. So then we go to the results. And when you create your heat safety plan, part of the plan is looking at your results after the hot season or after a year. And those results can include how many heat-related illnesses occurred over the past time period? What were the associated costs? How did you assess productivity? So you want to review these results, make adjustments, look at current research and what has worked for others in similar industry and heat risk, and reevaluate and go back through those steps and see where you need to make adjustments. Specific to your work site, your environment, and the job duties. So I'm putting this up here as something that was specific for my work site in Central Texas. I have created many heat illness prevention programs that basically included supervisor and employee training, encouragement of rest, water, shade, and medical surveillance, letting people understand their risk of what they may have individually and how to control that risk and prior to the work season. So implementing much of what I've just said prior to the heat, the heat illness, we called it a heat stress awareness program. There was approximately 27 to 24 heat-related injuries per 1,000 population. And then over time, over the years, it slowly went down to where the last 2 years we had no reported heat illness or heat illness injury or illnesses. And this was at the time, that was the hottest decade in record. So it was not that we had any change in temperature. And we suspected that it might increase a little bit since we were telling people, this is what the signs and symptoms to look for, and you need to come in and be, and be assessed. We want you to come in earlier rather than wait until you feel very ill or they're passing out or having to call 911 or calling for emergency services. But so we did expect it to go up, but 2011 was also a very hot year, notably hot year. We also, the mean average cost decreased by 50%. This is for a municipality, so productivity wasn't able to be measured. That's not something that we measured. But I like to show the results or just discuss the results. And there is a link in my resources that can give you more information on this. This was in the ILO report. I've also heard talks regarding the Adelante initiative in Central America. This was an initiative that was founded in 2017 to improve the working conditions for sugarcane workers facing extreme heat and its consequences, including heat stroke and impaired kidney function. In the first 3 years, they were able to reduce harm with a sharp decline, found 94% of cases of acute kidney injury. They also eliminated fatal incidences of heat stroke, and they increased productivity 10 to 20% and provided a 22% positive return on their investment in this heat illness prevention program. They also saw decreased staff turnover and absenteeism. So that is, and what they provided was mandated breaks, the mobile tents for accessible shade, accessible water and isotonic solutions, and the sanitation facilities. And then there is another case where the Sri Ramachandra Institute in India provided the heat stress education, scheduled breaks, provision of cold water, utilizing insulated bottles, and the optimization of the work attire. They also provided some engineering controls, providing engineering controls to help with to decrease the physical load as well in carrying heavy equipment or product. Their research team showed that they had a 57% increase in productivity and decrease in kidney disease and increase in health. Sorry, I'm trying to get my there we go, and increases in health parameters all around. So it was a really significant improvement in their heat-related illness symptoms and improved kidney function. So a great success. And again, you can find this in the ILO report. So my key takeaways is that when working to provide a safe environment that promotes worker health and safety and productivity in these hot environments, stakeholder commitment is essential. Assess the risk. So we know that heat is a risk, but are there other chemicals involved? assess the entire risk, and use a workplace specific heat safety plan for your work site. And then here is some of the resources I discussed. They all have links. So I divided them up into management. Just overall discussion of heat plan and education for management, supervisors, two different training guides, and like a 10-minute safety talk that you can modify for your site. And then for the employees, the heat related illness one page for employees and employer, actually on one side has personal monitoring tips and what health conditions they need to look out for, and how to address those. And then the QR code shows you is a link to the ILO report, which is a wonderful source of information. So thank you so much, and I'll hand it back over to Lisa.
Thank you. Thank you, Rhonda. Thank you both, Rhonda and Tom. I've allowed individuals to unmute themselves. If you wish to ask a question, I ask that you raise your hand, and I will call upon you to ask a question. We do have a couple of questions in the chat, however. So Vinjay from South Africa says, greetings from Johannesburg. While there are occupational health standards for exposure to heat and control measures can be applied to workplace to control exposures to heat in workplaces in developing countries, the question of employees who also face fairly warm, hot environments and conditions at night when they go home, and don't have to cool, makes it difficult for them to rest and return to work, and they are fatigued. So how do employers support employees under these conditions to help ensure health and safety in the workplace? Do either of you have any experience, or if anyone has experience who's on the line, that would be great if you could share that with us.
I can speak to that.
Great. Thanks, Tom.
Yeah, it's Tom Gassert here. I think you might see my image now as a camera on.
Yes.
Okay. So thank you. And also thank you, Rhonda, for your presentation. So Vijay, you're from South Africa. So this is a, a very common problem that's often overlooked. And, when the temperature is not dropping below 20, 26, 25 degrees or 20 degrees during the recuperative phase of your worker's 24-hour cycle. That means when they're off shift, not handling those heavy workloads. There are two ways to think about it in terms of the employer's responsibility or ability to help these workers cool down while they're resting, and they need to recuperate. They need to recuperate for all their organ system functions that have been stressed during the workday. So musculoskeletal, cardiac, renal, liver, brain. And all these are very important. So, and then rehydration and nutrition. So the two ways to think about this is, does the employer have direct control or not? If they have direct control, that means they control the let's say the housing of the worker and the transportation of the worker. So I've seen some places, workplaces in the tropics, where employers actually provide independent transport buses or vans. And these can be, if the employer can afford it, to have air-cooled or training of the transport drivers. As far as housing goes, the employer needs to and must invest in proper housing that allows for cooling and recuperation of core body temperature and organ system function. However, if they cannot, they can work with the local public health and community health services. So public health services is one way, and with community primary care services, they can coordinate with community health workers, people who go out in the field, and local leaders to provide methods of cooling in residential areas and housing areas, whether they're temporary or regular housing. Also, training is critical. So it's very important to train the worker that they must seek to cool themselves down, rehydrate, and get proper nutrition. If they are going on to do a second or a third job, that becomes an additive problem. Uh, so very often, if they're female workers, they're going home, they're taking care of children um, and trying to keep the children cooled down as well. Anyway, enough said on that one by me.
Rhonda, do you have anything to add to that? Or if anybody in the chat, anyone has experience with that in the chat, that would be great. It certainly is a challenge that is faced. Housing is a challenge that is faced by many workers worldwide. And adequate.
Yes, no, I think Tom addressed the possible options, and yeah, if anybody else has solutions, I know that globally, the night and day temperatures are narrowing, and when we're not able to get it under 70 degrees in the evening, the body does not have enough time to cool down. And one thing that I did not mention, but because there's so much to mention, is that incentives for overtime. I mean, if employers can limit overtime, add additional workers during the particularly hot periods, it is helpful. So we're not having those prolonged heat exposures, so persons can have time to cool down.
I'd like to also point out that in some jurisdictions around the world, there are minimum temperatures for heat, that there are standards for absolute minimum heat to provide heat in cold climates, but there's also now consideration being given to providing a maximum temperature for a dwelling for heat. So the provision that there would have to be some cooling on the part of landlords. To provide adequate housing. So that is a consideration that's being contemplated both here in Ontario and other jurisdictions. So just wanted to make people aware of that. There is a question from Richard Quenville. Are there any published clothing adjustment values for cooling vests that can be added to WBGT to estimate an effective WBGT? Anyone want to weigh in on that?
Yeah, sure. I can say something here.
Thanks.
This is an evolving science, and it's a kind of a high-tech area of hot environments, particularly if you're working in semi-contained areas uh, and around very hot radiant heat sources or doing very heavy labor. So I don't know that it's going to be particularly helpful to most people in most parts of the world, but where these cooling vests do come into use, um, uh, to estimate the effective WBGT, there are clothing values, and we can ask some of the experts on this what exactly they are. So a point to make is, and I'm looking at some of the other questions in the chat, and I want to answer this from Richard on the clothing values, but also to the others. In the next few webinars that we will have, I think we're going to have 3 more, we will be focusing on some of the questions that you're asking. So for example, the specifics about these controls, such as wearables. Uh, so, for example, Christina Van Hagen has asked, what about the wearables and person protected health information? And is there a way to collect data on individuals which does not disclose personal health or very sensitive kinds of information? And there are. We can talk about this in an upcoming webinar. There, there's also a question from Bernard Fontaine. Can we talk about chronic kidney disease and also pre-existing medical conditions? in another question, and we will be talking about this when we talk about the physiological and vulnerability of workers uh, as they go into each work shift that happens to be a heat stress condition. These will be addressed in a subsequent webinar. And Lynn Nelson mentioned, will there be speakers with OSH-focused people in unions or labor organizations or labor organization affiliations? And there was a response on that one from Ripan Chaudhuri, who mentioned the stakeholders agreement actually mandates that labor must be represented, uh, certainly in unionized shops. But we always recommended where there should be a workplace um, worker management health committee, health and safety committee, as part of your overall OSH plan for your work site. And then in that OSH plan would be your heat, illness, and injury protection program as a component of the overall workplace health plan that is monitored by the Joint Committee, Labor Management. Yeah, I think that kind of addresses. Oh, there was one other question from Francis from Ghana. Are there funding opportunities for students to obtain a master's or a doctoral degree? Yeah, it's a great question. Lots of eager young folks want to learn this stuff and become sort of experts about it and bring that kind of expertise
Yeah.
back home. So I would suggest that you look at the websites of the schools of public health in various countries, as well as some of the organizations that are listed in the resources. So Dalai Lama School, where Lissa
Yeah.
is based. I'm at the Harvard School of Public Health. We have programs, and there are many others. So local
Yeah.
universities and schools.
Francis, yeah, I just wanted to sort of add to that, Francis, if you're not aware of, but the MasterCard Fellowship, which offers public health training from numerous institutions, including the University of Toronto, and that provides full funding for the lucky recipients. We here at Dalla Lana in the Division of Occupational Environmental Health only accept about one to three students a year. But there is MasterCard does provide funding for other institutions. I encourage you to look at the MasterCard Foundation grants, yes, which are available to students in Ghana. There are a lot of great questions. Following up on the question earlier, simple nighttime temperature thresholds above which a worker can be assumed not to be recuperating from daytime exposure. That's a really good question, Brian. I'm not sure whether there's an absolute temperature. I know that 26 and 27 degrees have been Celsius have been bantied about as a minimum, as a maximum temperature, indoor temperature, but I don't know what the science is saying on that. So something that we should look into, and I don't know if Rhonda or Tom can comment on that.
Yes, I can take that. So you have your ambient temperature. If you remove radiant sources, that lowers the you might say the WBGT effective. So removing radiant sources and increasing air movement, and then using adaptable cooling sources. So other than air movement, it could be moisture, it could be uh, damp wipes, a cool bath. Uh, going outside, if it's cooler outside compared to inside, increasing circulation in the enclosure.
And well, one last before we've gone over time though, but Cleophas has actually said asked a question about direct reading and traditional measurements. I think we definitely have to have a session on measuring heat exposure. So that's something that we hope to be able to bring you in the future. There was a question about dates. We haven't set the dates yet, but our intention really is to try to offer one a month. And there was also a note about train the trainer training, and I'm beginning to think that a train the trainer package might be something that's very valuable and appealing to a lot of folks. So if you're interested in that, please let me know. It's something that maybe we can try to get all of the experts who sit on our committee to try to put together something that's effective in a train the trainer package. So I think I'm going to have to draw this to a close. We are over time, but I thank everyone who's still on the line, and there are 128 of you. We keep your eye out. We will send you a notice about upcoming webinars. You can expect one in June. We're meeting next week to try to set the date, and we'll definitely keep you all informed. And please, if you're interested, by all means, reach out to us. If there's something you want to hear, we want to hear from you. So, or if you can contribute, that would be great. Well, thank you once again to our speakers, and thanks to all of those who attended. And I wish you the very best for the rest of the day, and have a lovely day and week, and we'll be in touch again.